she just was in pain. She had gotten a bruise and it just didn't go away.
I had had a really bad sinus infection. After the antibiotics had gone through and I could breathe from the sinus infection, my body just hurt from head to toe. My name is Lisa LaRusso McGowan, and I was diagnosed with scleroderma in 2004. At the time, I had gone to the doctor's office to see what the blood work was, and he told me that, well, you've come back with this SCL70 antibody, and never hearing about this before, asked what it was, and he said, you have scleroderma.
So scleroderma is an autoimmune connective tissue disease where there's dysregulation of your immune system and dysregulation of how much collagen is in your skin, so that you get poor circulation to your hands and feet, so-called Raynaud's phenomenon. So it usually is the starting symptom. And then tight skin, which can affect any place from the face to the toes. And then sometimes your internal organs, such as your lungs, your heart, or your kidneys, can also be attacked by excessive amounts of collagen and inflammation.
Still having no idea what it was, I'd never heard of it before. I said, well, what is it? And he said, well, if this was the 1950s, you'd be dead in 5 years. And of course, after you hear something like that, I don't really remember too much of what he said after that, but he said that it was something that did not have a cure, but just because it didn't have a cure didn't mean it was untreatable.
At the moment, we're still stuck with trying to find the best treatments for the various complications, such as high blood pressure, pulmonary artery hypertension, tight skin, and stiff lungs. One would hope that you might discover an immune-mediating agent which would shut the whole process off and the disease would resolve. But we're not there yet unless we go to this massive stem cell or bone marrow transplant that requires a lot of chemotherapy with the associated risks.
Still a little overwhelmed. I remember leaving the doctor's office and crying the whole way home and thinking, how do I tell my husband that I have scleroderma, and not even knowing quite what it was myself and what the outcome was.
At the beginning, Lisa took it very hard. She was a little bit of a basket case. She's better now, but she was a basket case at the beginning. And we just had a daughter, so, she was a year old. And it was hard. It was hard, keeping up the, facade of being strong when, everything's falling around. Because, they say they gave her a, 5-year bell curve, you never know what's going to happen. I might have 5 years with her. I might have less. I have more. It's like throwing. You're playing dice. You never know what you're going to get. So it was difficult at the beginning.
Along with any person who is told by a doctor you have 5 years to live, I did go through a really rough patch of depression. When you have a toddler and you're trying to get her dressed in the morning, and you have difficulty with your hands. It's frustrating. There's many times in my life where I felt very useless and just didn't know if I want to be here anymore. And if this was just not fair.
Switch. There's Lisa.
Hi.
Like close up with no background light. Okay.
Hi. Hi, Joyce. How are you? Hi, Lori. Hi, Frank.
Rangers t-shirt.
Yes, Stanley Cup champions. Thank you. And Frank, they are a hockey team.
Okay. If you thought they were a basketball team, that's okay.
My husband, who just would get so upset when I would get upset, he kept guaranteeing that I was going to see my daughter grow up, and I I just had such a will to do that, and knowing that when I got diagnosed, my daughter had just celebrated her first birthday, I was dead set on making sure that I was going to enjoy every birthday from then on end and just really enjoy my life. And I'm happy to say in less than a month, I'm going to be celebrating my daughter's 13th birthday with her. And it just is such an incredible feeling. And even though this absolutely horrible illness has changed my life in ways that I would never ever want or wish or imagine, or wish on my worst enemy, I really have a positive prognosis that if I keep fighting and keep vigilant to make sure that I keep up and listen to my medical team, that I can beat the odds. And though, most scleroderma patients don't really last 20 years or more, I'm hoping to make sure that I'm going to beat the odds for that. And, I'm hoping to be around for not only my daughter's 13th birthday, but her 18th birthday and her 28th birthday and 38th birthday. And I'm going to hang on as long as I can. The one thing I think I've learned over the past 11 years is that it's not personal. It's just something that's happened, and it's the cards that I've been dealt. So I've got to buck up and play the best hand that I can. And the hardest thing for me is I always like to picture where I'd be in 5 or 10 years from now, and I truly don't care about that anymore, because if anything, I've learned how to live in the moment, and it was something I always thought I did, was live for now, and I never really did. Now I really enjoy every aspect of my life. I enjoy spending time with my daughter. I enjoy when I could help volunteer and help out my husband's fire department or my church or anyone, or giving some words of encouragement. I'm happy that I'm still here, and I'm still here.